Hello, thank you for joining me. As previously communicated, West Jefferson and East Jefferson are exploring a partnership with a prospective healthcare system. We are well underway in this hospital board-driven initiative and are conducting the appropriate due diligence related to it. Federal reform is here and we must change. Standalone hospitals locally and across the country will not be able to survive in the changing healthcare industry unless we become part of a larger system. Working with our national consultant, Kaufman Hall, we are evaluating the best structure, the one that's going to work best for West Jeff and East Jeff. The important goals for us are maintaining our quality of care, expanding services, and preserving West Jefferson's identity for generations to come. We want our patients to continue seeing the doctors they've come to know and trust. West Jefferson opened its doors in 1960. A few short years later, Medicare and Medicaid began. And then in 1983, the DRG reimbursement basis came into play, and it changed the way hospitals are reimbursed for Medicare patients. So even back then, the federal government realized that the Medicare system was going to be insolvent. Today, a large percentage of our patients are covered by government insurance. We are approaching 70% combination of Medicare and Medicaid. These are rates that we have no ability to negotiate. In 2009, a third hospital district was formed to permit West and East Jefferson to work together in some areas such as purchasing and other back office functions. West and East Jefferson are service district hospitals, meaning that we are local public hospitals with defined boundaries. For West Jeff, our service area is the West Bank of Jefferson Parish, and therefore we cannot by law put a clinic in St. Charles Parish or even down Bellchase Highway in Plaquemines Parish. With federal healthcare reform passing in 2010, the urgent need to move forward with a partnership became increasingly apparent. Size will be critical in the near future. Looking at the local market here in the New Orleans area, West Jeff and East Jefferson would not be of sufficient size and scale to migrate the reform initiatives. Plus, we'd continue to have those service district geographical limitations. So in 2012, the 3rd District issued requests for proposals. The many RFPs were received, and we narrowed those down to 3 potential partners. West Jefferson and East Jefferson are also burdened with prohibitive language in state and local laws. Currently, both laws prohibit a sale or a lease of West Jeff or East Jeff without a vote of the people. At our board's request, the Jefferson Parish Council has asked the state legislature to remove lease language from the laws to allow for a possible lease transaction without a vote of the people. Although public, we compete with other private hospitals in the marketplace, and a public referendum could cause some serious unintended consequences for us. There are 2 main reasons. Time is of the essence, and every day that goes by, we may not have the ability to select the right partner for our hospitals. And secondly, exposing our financial weaknesses could create a negative perception in the minds of the healthcare consumer. Our hospitals are not for sale. We're not asking for any change relative to the prohibition of a sale without a vote of the people. Even the major rating agencies such as Moody's and Standard & Poor's have serious concerns about standalone hospitals and are downgrading the majority of relatively small community hospitals like the West Jeffs and East Jeffs. This is another reason that becoming part of a hospital system is so important. For our hospital and the community, the partnership process is a vital one to maintain quality and to grow healthcare services. We want to grow, expand, and preserve jobs here at West Jefferson. We will continue to keep you informed on our progress, and we welcome your questions. Thank you for staying engaged, and thank you for your support.